So I'm going to talk a little bit about the questions that we commonly get asked in the office. And the most common question is regarding fever. First of all, when parents are trying to determine if fever is concerning, it depends on the age of the child, how the child's acting, and what other, if the child has any other diseases. So for example, a child under 3 months of age, any fever is important, and that should cause a parent to go ahead and call their doctor, even if it's in the middle of the night, to get further advice. Older children up to probably 2 years of age, it wouldn't be at all uncommon to see fevers of 101 or 2. But if a child's under the age of 2 and it's over probably 102, again, you should probably call your physician. And then children above the age of 2, even a fever as high as 103 would not be concerning as long as the child's acting okay. And so there's no one particular temperature that you can just pick and say, this is the point where I need to call my doctor. So it depends on the age of the child. The other important thing is how the child's acting. So if a child is running around and you have to call them inside to take them to the doctor, they're probably fine. On the other hand, if you're having trouble getting them to wake up, if you can't get them to make eye contact with you or respond well to you, or if they're showing signs of trouble breathing, bluish color to the face, or any signs of dehydration, then that's really important regardless of how high the fever is. Now, what to do about fever also depends on a number of factors. Very young infants, we do not recommend that a child under 3 months of age be treated for fever. Instead, that child needs to see the doctor. So if you have a child under 3 months of age with a fever, you need to call the doctor, even if it's the middle of the night, and they're accustomed to those calls for these very young infants, prior to treating with any medication. If children are over 3 months of age and otherwise well, then it's appropriate to use acetaminophen. And then older children who are well hydrated and otherwise feeling well, you have the option of using ibuprofen. However, we do not recommend that you alternate 2 different fever medicines, but that you pick one and stick with it to avoid any overdosage or confusion in the dosages. The other important factor about treating fever in children is you should never use aspirin in any child under 18 years of age, particularly with the influenza, because there is a risk of Reye's syndrome being associated with aspirin following an influenza-like illness. And so it's important when you pick up multi-symptom products over the counter to look at the ingredients and see if there's any aspirin, because there are a surprising number of medications that include aspirin that you don't necessarily realize, and it may not say that in the title. So just make sure to read the ingredients, and if aspirin's involved, then you shouldn't give that to children. Well, we always recommend the flu vaccine for children, particularly young children. And it is in the recommended category for all children under the age of 21, but particularly children under 5 years of age. The recommendations for the swine flu vaccine are going to be very similar to that. And I personally would much prefer somebody come in and get the vaccine as have to worry about the side effects or the issues later on when they have fever and they're not sure what that is. And so we would definitely recommend vaccination for children. It's just that right now that's not available to us at the time when we're seeing an awful lot of cases. The other important thing to remember again is the children with other problems. So children with asthma or with diabetes, cystic fibrosis, any lung problems, anything that would cause them to be immunosuppressed, really need to get not just the swine flu vaccine, but also the seasonal influenza vaccine. Yes, we expect to continue to see swine flu, and then we also expect our normal influenza season, which usually gets really going in December and January. And then when we have seasons when the influenza is more prevalent or more severe, we do often see more other illnesses such as routine cold viruses, RSV, things like that. And so, yes, we expect it to be a busy year for the whole year. At this time of year, yes, because again, we don't normally see seasonal flu this time of year, and so it's the CDC's position that if we are seeing influenza right now, that it is the H1N1, and we would not expect, if it's a normal year, to begin seeing seasonal flu until much later in the year. By the time the regular flu, seasonal flu begins, then we would expect to see seasonal influenza A and B. Whether the novel H1N1 will have disappeared by that time is anybody's guess. Well, we're really trying to follow the CDC recommendations just because they address public health probably much better than we do. And the recommendation so far has been that most feel that that wouldn't help a whole lot because it's so prevalent in the community. There is a point, of course, where if enough students are out, you can't hold effective school because there's nobody there to hear the teachers. And so certainly from that standpoint, eventually some schools will likely close, and in other communities that's happened. But in terms of containment of the virus, the feeling from the CDC is really that it wouldn't be particularly helpful. One thing that is important, I think, for parents to recognize, though, is if they keep their child at home, and the current Tennessee Department of Health policy states that if a child has flu-like symptoms, so fever, cough, headache, body aches, some children with vomiting and diarrhea, sore throat, that sort of thing, that they remain home until 24 hours after the fever has resolved without medication. So you can't give them Tylenol and then ship them off to school and say that that counts. So, but the important thing for parents to remember is if it's important enough to keep them home from school, it's important enough to keep them home from everything else. So that means if there's a football game that night, they should stay home from that as well, and they should stay home from gymnastics or any other activities. And the CDC recommends that if someone is home from work or school because of flu-like symptoms, that they only leave their home for medical care or basic needs. And so it's important that people do while they're febrile or ill, to take that seriously, stay home, and then go back after they're well. For otherwise healthy people, I think that is fair to say. There are a couple of subpopulations that, for example, pregnant women that seem to be being hit harder with this flu than perhaps we're accustomed to seeing. And again, the number of illnesses at this particular time of year is very unusual. We are far busier than we would normally be in early September, but we are not seeing severe cases in otherwise healthy children and healthy people. So if you're not in one of those high-risk groups, such as a young infant or a child with an underlying illness, then you're probably going to act very much like a cold, and you should be able to treat that at home very much like a cold. It's very difficult within a household to keep a virus from spreading throughout the household. And so for otherwise healthy children, I think it's reasonable to pretty much expect that if someone comes home with the virus that you're all going to get it. But there are, again, some groups that you have to be extremely careful with. So young infants, someone who's immunosuppressed, that sort of thing, requires some special measures. For example, a mother who is breastfeeding, the recommendation is that she can continue to breastfeed. The breast milk is certainly not harmful, and it is actually helpful. But during feeding is an awfully difficult time not to spread germs, because during a 20 or 30 minute feeding, it's very likely that the mom is going to cough or sneeze or need to wipe her nose. And so it requires a lot of extra measures. The recommendation for a mother with swine flu who is felt to be contagious should wear a mask while she's breastfeeding her infant. And perhaps if she's really ill with it or during her most contagious time, even consider expressing her breast milk and have another caregiver in the home feed the baby for a day or two, if that's possible. It's not always possible. For everyone else, certainly with toddlers who tend to touch everything and tend to sneeze and cough everywhere, you're not going to be able to keep them from doing that. And so the best bet is for everyone else to wash their hands frequently, any surface that they've coughed or sneezed on to clean it as quickly as you can, and hope for the best.